Hi, I'm Kingo Hirasawa from Yokohama City University Medical Center. I'm the corresponding author of this article.
Hi, I'm Yuichiro Ozeki of Yokohama City University Medical Center. I'm the first author of this article.
In this interview, we are going to introduce our newly accepted article entitled Safety and Efficacy of Water Pressure Endoscopic Submucosal Dissection for Colorectal Tumors with Submucosal Fibrosis. We are very honored to have such an opportunity. First of all, what is water pressure ESD?
Water pressure ESD is an ESD procedure that utilizes active pressure created by saline solution infusion through an endoscopic flushing pump. After the mucosal incision, we infuse saline solution into the dissecting submucosal layer. That opens up the submucosal space and makes the dissection line clear. On top of that, the region in the affected segment of the colorectal lumen was submerged over the procedure, creating a saline solution immersion condition. The condition provides a floating force that lifts the mucosal flap from the muscularis layer, as well as a clear endoscopic view without lens glare or clouding.
Water pressure ESD is a technique originally proposed by Dr. Yahagi in Japan for the duodenal tumor. On the other hand, the term underwater ESD has been reported in the field of the colorectal endoscopy, thus causing confusion as in terms. Which one should we use? We had to ponder first. As Dr. Ozeki mentioned earlier, water pressure ESD includes the meanings of both subimaging and visual field expansion by water pressure use. So we believe that this name water pressure is appropriate in this technique. So why did you carry out this study?
Recently, therapeutic GI endoscopy has increasingly utilized fluid immersion techniques such as underwater EMR. We have treated colorectal neoplasms by using water pressure ESD since 2017. We felt that this technique improved colorectal ESD considerably, so we decided to perform a comparative study comparing water pressure ESD and conventional ESD.
Okay, thank you. So in this term, why did you target colorectal neoplasms with submucosal fibrosis?
Because severely fibrotic colorectal tumors are the most difficult target of endoscopic resection. Few effective strategies have been reported against them. We believe that water pressure ESD is effective in all colorectal cases. However, ESD for general tumors has already produced satisfactory results. Therefore, we focused on the most difficult targets to evaluate the safety and efficacy of water pressure ESD.
Demonstrating the superiority of water pressure ESD over ordinary regions has been difficult in controlled trials. Skull regions were a very good target to show its dominance because it needs longer procedure time and have a higher incidence of adverse events. So, what was the main outcome of this study?
Our main results can be divided into efficacy and safety. Regarding efficacy, we demonstrated that water pressure ESD can shorten procedure time for treating colorectal neoplasms with submucosal fibrosis. On the other hand, we could not find significant protective effects against adverse events such as intraoperative perforation and post-ESD electrocoagulation syndrome. Regarding safety, we showed that a minority of patients who underwent water pressure ESD showed fluid correction by using computed tomography right after the procedure. While moderate to massive fluid correction was associated with a prolonged hospital stay, no patients required surgical treatment.
Some endoscopists may be concerned that applying water pressure may lead to ascites or even peritonitis. Since we previously reported to GRE a significant association between CT findings immediately after ESD and coagulation syndrome. Thereafter, we have taken CT immediately after ESD for these difficult cases. This led to another new findings in this study. That is, the elucidation of the dynamics of water in the case of perforation under water pressure method. We believe this is very impressive findings for readers.
What do you think is the key to a successful water pressure ESD?
In fact, I don't think there are any particular tips. This is because there is nothing you need other than the water jet function and just step on the pedal. We can return to normal situation at any time. One thing to keep in mind is when you encounter bleeding. In severe bleeding, the field is filled with blood, making it difficult to get good viewing. In these situations, please press the hemostatic point with an attachment to reduce blood flow, and then we will secure the field of view. After that, when you move the scope little by little to stop bleeding, you can stop bleeding well. What is the future perspective about water pressure ESD?
In this study, we mainly evaluated short-term outcomes after water pressure ESD. In contrast, long-term outcomes such as relapse-free survival should be further evaluated. The biggest concern of tumor dissemination after fluid leakage into the abdomen needs long observation.
Thank you, Dr. Ozeki. I hope many readers will be interested in this interview. In conclusion, water pressure ESD can improve your colorectal ESD procedure without dedicated devices. You can check out the video footage online on GRE website. We also welcome visitors in our endoscopic center. Feel free to email us for further information. Thank you for watching.